the great challenges of dealing with the reality of cancer in our community. And I can only imagine, I have not had this experience firsthand, and I hope I don't have it, but I've been told that one of the great challenges of dealing with a cancer diagnosis is the many hours that are spent undergoing chemo in a hospital situation. And it is this area into which my next guest has stepped. Julie Wilkes spent something like 25 years working in Perth hospitals and says that all too often she saw a cancer diagnosis disrupting and really consuming the lives of patients and families. And now she offers a chemotherapy business at home. Julie, welcome to the program.
Thank you very much, Geoff.
How does it work?
Well, basically, it works very similar to a hospital-based situation, except for that instead of the patients coming to the hospital to have their chemotherapy, they stay at home in the comfort of their own home. They don't require transport to the hospital, they don't require parking at the hospital, and they don't require a carer to sit with them in the hospital for that length of time. And so the nursing staff come to the home with all that they need to do their chemotherapy treatment at home and do it in the home and stay with the patient for the length of time that they have the treatment and then leave them in peace for the rest of the day.
How many patients are you seeing, Julie?
At the moment, we're seeing about 60 or 70 patients during the week, and that number is increasing as time goes by.
Okay, so you're getting more and more referrals as time goes by?
Yes, absolutely. As more and more people become aware of what we do, and up until a few years ago, this wasn't an option. So it's getting the word out there. And once they realise that they can have their treatment at home and that it's safe and that their doctors support it, they are very excited to be able to have their treatment there.
And this is available to both public and private patients?
No, at the moment it's only available to private patients. We are talking to the Health Minister at the moment, and we're very hopeful that he sees the benefit in this as well, because it obviously adds an increased capacity to the system over and above what you can offer in day units. Indeed.
And at what kind of cost to patients in the private system?
In the private system, we have contracts with all the health insurance funds, so it's no gap to the patient. They don't pay anything.
Why did you become involved, Julie?
Well, really, I guess over, as you said, many years, I saw that patients wanted to be treated closer home. Most of our cancer centres are clustered in the centre of the city, and even going to a hospital for many patients is very stressful. Finding parking, particularly since cancer is mostly a disease that's more common as you get older, it becomes much more difficult for people to be able to travel to their appointments and travel to their treatments, etc. And so we saw the benefit of being able to treat them at home. Also, too, it's a cheaper option. It's much cheaper to buy a car and put it on the road with a nurse than it is to build a new hospital, as we've seen with our new hospitals.
So, Julie, what does it provide the patient? I know, obviously, the time saving, the familiarity of home, but is it some reassurance and maybe even a sense that there's a little bit of control over their destinies?
Absolutely, absolutely. It's been shown in numbers of studies that some better outcomes for the patients. They have less infection rates. But also, you're right, that there's less stress and less depression and less anxiety when they're treated at home, because their house is a familiar place for them, and so they just stay in the comfort of there, and we're sort of like the visitors to them rather than being the visitors to the hospital. So there is a shift in the power of treating patients at home, and that empowerment, I think, is very strong for people and provides them a lot of comfort.
When we talk about the challenges that the health system faces with more and more people needing care, and Terry Slevin said we simply don't have enough doctors to provide for that kind of demand, are we going to see increasingly more and more of these services made available? 5 years from now, will we comfortably believe that in the public sector as well you can have chemo at home?
Absolutely. I mean, I think in the future there's no doubt that this is the way forward. There is no capacity for the health services to build enough resources or enough hospitals and day units to cope with the number of patients that will be coming in future decades. So it's to me quite obvious that when you don't need to go to hospital, you shouldn't be there. And if you can have treatment at home, that's where it should be. And then the hospitals should be left to the patients that need to have treatment there for whatever reason. That might be personal reasons or it might be clinical reasons. But, those patients should be allowed to go to the hospital as a part of choice. But for those who can and choose to have their treatment at home, I have no doubt that that's the way forward to be able to cope with the numbers of patients.
Thank you so much for talking to us, Julie.
My pleasure.
Julie Wilkes, who is the Managing Director of the Chemo at Home scheme that was introduced a couple of years ago. This